Stress is common in children, and there are all types of stress. Some children have good types of stress, like the stress of going to school for the first time. Then kids learn from this stress and they realize that they are safe and secure, and it makes them more resilient. And then there's toxic stress, and this type of stress is very dangerous for children because it imprints on them maladaptive behaviors and even physiologic consequences that prevent kids from being as healthy mentally, emotionally, and physically as they should be.
We didn't have a process for when we're suspicious of child maltreatment and we discharge them from the hospital, what do we do next? And so I reached out to our Allen County Health Commissioner and then eventually came up with the idea of a medical follow-up clinic. Reached out to Dr. Giaquina, one of our pediatricians, and connected us, and that's how it all began.
We have a catch from all of the emergency rooms where if a child is suspected of being abused or neglected, they have a straight shot handoff to the Better Future Clinic. They can call us and describe their concerns and get them an appointment slot with us so that we can then take the reins. And it's important that we can do this in a clinic that is warm and inviting and has all of the connections to offer them rehabilitation to heal from their injuries, wounds, or get the social services that they need so that when a child is exposed to stress, trauma, or abuse, that they have a path forward towards being healthy and being the best child that they can be. We're really, really proud that we can offer this to our community to help parents be the best parents they can be and hopefully prevent the cycle of abuse and neglect.
One of my ideas is that I wanted a clinic that wasn't medical looking because I think that does create some fear in kids. And so familiarity was the key. And something familiar in our area is the Fort Wayne Children's Zoo. Having animals and a zoo theme would be very familiar to our community. And so using that idea, I went to the Fort Wayne Children's Zoo and we took it to our designers, and that's how we came about. When children come in, it's just bypass the lobby, go straight to a room, actually go with a child life specialist to be distracted. And it's really an open space for children. It's if you want to go to the kitchen and get a snack or wherever the child wants to go is the way for this clinic to be, rather than an adult saying, you can sit in this room now or, in this space. It's more control of the children, on where they're going to sit.
You're going to meet with a play therapist who is designed to understand the stresses that your child might have occurred. Better Futures Clinic will also have you meet a social worker.
That social worker is able to connect each family with services, and there's numerous services that are available. It's just a matter of most people don't know how to connect themselves with those services.
Their whole mission is to make sure that you have everything that you need. We're not going to stigmatize you or judge you, and we know that every parent wants to be the best parent that they can be. And we know that parents love their children, but sometimes accidents happen. Sometimes a parent is so stressed that they act out on their children in ways that they're not proud of. And we know that when a child is removed from a parent, that is an ACE. That is an adverse child experience. This clinic can help provide those resources for parents and be able to be the parents that they want to be. And honestly, the typical fee for service is something that we're not focused on in the clinic. And in order to do that, we've had to really reach out to the community. And we've been so blessed and lucky that the community has responded loudly saying, yes, this is important and something that our children deserves. We've been so fortunate to have Parkview Foundation as a community partner in this effort. And everything that you see just couldn't have been created on its own.
I think the reality is that we'll see the volume increase as the word gets out to healthcare providers. The goal is to have no children to follow up on, to never be suspicious of child maltreatment.
We want to be available for the community to tell us what they need, and we want to service them. We feel like this is a blank canvas, and we're just getting started with the painting.